So, welcome to the Practice Makes Progress podcast, where we explore the experiences and insights from practitioners within Devon Partnership NHS Trust. So, I'm your host, Dan Knapman from the Practice Education team. In this episode, we're lucky to be joined by a special guest, George Capone, a clinical psychologist who works in mental health teams in North Devon. George brings a wealth of knowledge and passion to the table, particularly in areas like schema therapy and embodiment. Whether you're currently in training or stepping into your preceptorship as a newly qualified practitioner, there's something here for everyone. So today we're going to dive into a variety of topics touching on common pressures and challenges in the mental health field, and we'll gain some valuable insights into George's career journey and get a glimpse of what a typical day looks like for her. So if you're considering placements in community mental health teams or are curious about clinical psychology, schema therapy, or embodied approaches, you've come to the right place. So let's dive into this conversation on the path to making progress in our practice. Hey, George, thanks so much for taking the time to speak with us today.
Yeah, no worries. Nice to be here.
Likewise, it's really good to have you here. I suppose to get started, I wondered if you could share a little bit about the kind of work that you're currently involved in.
Yeah, so in terms of my NHS work at the moment, I work in across two adult mental health community teams. So I work across Barnstable Community Mental Health Team and Abbotsvale Bideford Community Mental Health Team in North Devon. Um, I don't know how much detail you want me to go into at this stage about what I do.
As much as you feel comfortable with, yeah.
So my job's changed a little bit. When I first started, I joined as it was kind of a split job, and I've reduced my hours now from full-time to part-time. But essentially, part of my job is supervising clinical associate psychologists through their training. Um, and we've been implementing and embedding that role across the trust, working with senior leads to support integration of that role into services, as well as supervising individuals, clinical associate psychologists through their training and post-training experience, integrating into community mental health teams. And the other side of my role is I guess using the rest of my clinical psychologist skills, so staff support, reflective practice, supervising other professionals, offering consultation and advice on how to work psychologically for people in the community mental health teams, supporting trauma-informed practice by being present at multidisciplinary meetings, one-to-one therapy work with people on our growing waiting list.
Absolutely. I suppose that lines us up for thinking about the next question in terms of considering what do you think are some of the common pressures or challenges that you might face in your role?
Well, I don't know if these are necessary. I don't think these are necessarily really unique to a psychological role, but generally the NHS is just getting more and more stretched, isn't it? So I think some of the real challenges are providing psychological therapy to a growing number of people. And I think it's great in a sense that in the world that we live in today, we're so much more aware of mental health difficulties. Um, and in a way, more and more people are potentially accessing help than they would have done before, which is amazing. As well as mental health awareness, there's also issues around the world that we live in today in terms of financial pressures people are under, and social media, all sorts of things which are heightening people's kind of experiences of mental health difficulties. So the need is growing, and the NHS budget is shrinking.
Yeah. Yeah.
So there's a mismatch in what we're constantly seeing, like as in terms of from my view as a psychologist, is a gap between what we provide in the NHS and then what's available outside in the community. And often there's a lot of people that could really do with that prevention and more short-term support that don't necessarily meet the criteria for our adult community mental health teams. And that's really difficult when you, and I'm sure the rest of my colleagues, it's not a unique value to myself, as you value kind of proactive and preventative community-based ways of working, but the budget and our standard operating protocol, our SARP, our service criteria don't allow for that. And that can be really tricky. I'd say that's one of the biggest difficulties in work at the moment facing our
Yeah.
department.
very interesting that you mentioned that. And I suppose there's a common theme that's coming up in the podcast is the recognition of some of the constraints that can come about from kind of working within NHS services and the pressure and the demand that's being placed on them at the moment, particularly in the kind of psychological work streams, can be really challenging. And just thinking out loud, that sense of the other part of your role, sort of embedding the CAP role across community teams, sounds like it's kind of part of that picture as well, by being able to offer kind of an increased amount of kind of psychological work within those services. How have you found that experience of kind of working with CAPs?
Yeah, really, really good. I really enjoy supervising, and I've had some really talented, like motivated, enthusiastic people to work with and to support their training. It's a real pleasure to support and nurture people to grow. I think in the current context of like mental health services, it's particularly difficult introducing new roles and for people to go into teams that are already overstretched and potentially only have capacity for firefighting rather than lots of or more psychological thinking. So it's a great idea, but what we've really been up against is kind of how you integrate those roles into teams who essentially are dealing with and trying to support a lot of people who aren't ready for even short-term psychological therapy and are potentially understaffed to meet kind of routine appointments, which is what some of those people need for basic stabilization, more social and practical difficulties that they need support within their life. So there's a great intention and a great idea, and then the reality of meeting services is where they're at.
Yeah.
If that makes sense. So we've been trying to navigate that kind of landscape in terms of, well, how can we think about how CAPs can work flexibly and dynamically to meet the service need while also within the boundaries of their role as psychological kind of workers, really, clinical associate psychologists. And there's been some great work that my CAPs have done, which has been brilliant. And, from other CAPs across the service that I don't supervise that I hear about. Coming towards the embodied group that we piloted and started in North Devon, that's been a big labour of love between myself and my CAP, Nikki Taylor here, and our very supportive manager at the time, Bill Wall, who stepped down, who supported us to create give us the space to create something that was a bit more out of the box in terms of how can we offer an emotion regulation group to people, because there was a drive across the trust to increase capacity for people to access therapy through groups. And we all know groups are a great idea, but they take a lot of time and power and labour. So the clinical associate psychologists have been great in terms of supporting psychological provision in that respect. And without Nikki, I don't think we would have been able to sustain it all. The emotion regulation group that we've built that has that embodied aspect in North Devon, and we've had some amazing, exciting results from that. Nikki now leads on that in Barnstable Community Mental Health Team, and it's amazing. It's been amazing to see the life-changing results that people have had. We often measure effectiveness through discharge, but what we've been noticing through the qualitative feedback we get through the kind of verbal feedback we get from people at the end of the group is, I've been able to go to and stay in my college course, which has been like really meaningful and amazing change, isn't it? Which is difficult to capture at times with the measures that we're encouraged to use.
Yeah, I love that. And I think I remember there was a presentation about that at the recent PPN conference. Is that right? The one that we had in November. Yeah, it was really interesting to hear about that work. And I think what's really lovely is it brings a different perspective, doesn't it? You're talking more in terms of sort of patient outcomes from their own perspective instead of some of these various different questionnaires that we might be using routinely. It's really lovely to hear about qualitative responses to the work that you and your CAP that you've been supervising have engaged with. So that's awesome.
Yeah, and not to neglect Bideford Adult Mental Health community team, because we've recently restarted a group there, and the hope is to hand that over to the community mental health team so they can run it there. And we've had some very enthusiastic, supportive staff members piloting that I'm going to name drop because they deserve a mention. So like Imi Curtis, peer support worker, and Esther Dyer, one of the nurses that are new to that team.
Yeah.
Because it takes motivated and passionate people that are willing to take a bit of a risk despite having quite a high caseload or like enough work pressures already. It can be quite difficult to find the energy to do something creative or take on something new, can't it?
Yeah, and encouraging other people in the team to sort of slow down, to engage in that more kind of psychologically informed thinking and way of practicing can be a significant challenge, I think, across the trust at times when, as you mentioned, our colleagues are working with really high caseloads under a lot of pressure with lots of outcomes that they need to be meeting. Yeah, just lovely to hear about that, the reward that you're taking from that, as well as the personal sense of, we've done something that's been really positive here. Lovely to hear. I'm interested to think a little bit about what a typical day looks like for you. I know you've just changed your working hours, but in terms of your NHS role, is there a typical day? What does that routine look like for you at the moment?
Yeah, it varies from day to day.
Mhm.
And that's why I still really like my job. I think I'm the kind of person that needs variety and the right level of challenge, within within my range of emotional capacity to handle. Which is definitely growing with my experience. Can't believe I'm, compared to some of my colleagues, not that experienced, but 10 years qualified. I don't know where it's gone. Don't know where it's gone. It's quite scary, isn't it? Sometimes when you think, how fast has time gone? But a typical day, for me, generally, so for example, I guess like take a typical say like Tuesday, might look like supervision in the morning and then for therapy client appointments. On another day like today, I'm supervising and co-facilitating a therapy group, um
Yeah.
and going to a range of different meetings this afternoon, including like a multi-agency team meeting where we think about referrals potentially from clients who are sitting within the gap between Talkworks and our community adult mental health service.
Oh,
So
that's interesting. Yeah.
bit of kind of on the spot formulating, thinking about people, supporting people to think psychologically in terms of what support needs and treatment people can access,
Yeah.
as well as our department, so our psychological therapies department meeting, which is also on a Thursday. Um, and then this is my space for other kinds of meetings like consultations. So people in the staff community adult mental health team that might want to meet to talk about some of the clients on their caseload, and think through what to do with them, what kind of therapies might be helpful. So a real mixed bag.
Yeah, absolutely. A mix between that kind of one-to-one clinical work, you're doing a lot of supervision, but also the real kind of strategic elements and that interface working between primary and secondary care as well. Yeah.
Yeah, in statutory and non-statutory services. I think,
Right.
one of the great things about as much as the community mental health framework has had its challenges, it's great to see more kind of close and partnership working between what is that? I can't even remember what the BCSE stands for. Voluntary charity.
Don't ask me, don't put me on the spot.
I feel like I should know, but I'm glad it's not just me. But
No.
voluntary charity sectors, other private companies out there
Yeah,
supporting each other to think more creatively
yeah.
about our options for supporting people. And I think it's brilliant. And from that, you know, I've really valued being able to work alongside different professionals, and inspire each other with other ways to work with people,
Mm,
and ideas for support. I think that's one of the definite pluses.
yeah, absolutely, absolutely. Amazing. So it sounds like you're quite busy. There's a lot going on. I can see why you don't ever get bored in this job. There's lots of change and lots of different things to be thinking about a lot of the time. What about your journey? So you mentioned you've been qualified for 10 years now, and I'm wondering a little bit about how you found yourself in your current role. What was your route towards clinical psychology?
Oh, what a question. So what was my route towards clinical psychology before I got into training?
Yeah, yeah.
Yeah, I mean, I didn't know until later on at university that I wanted to do psychology. And it was only through having a very charismatic lecturer at uni who really sold me the idea of how it can be really cool to understand more about why people do what they do. And I got into it through the really morbid, fascinating side of things of criminal psychology, forensic psychology. We
Mm,
had a lecturer at Birmingham City University where I went to. I just did a great course on criminology, and it was, I think, Professor David Wilson who headed up the course, who lectured us, took us to Gwendon Therapeutic Community prison, which was an
yeah.
amazing experience, and got to really see how you could work psychologically with people who have had really complex, horrible, challenging lives. And I became
Mm,
really interested in how you could use kind of your understanding about people to support them. And I've always been quite a curious, nosy person. So it just fit. I mean, initially I wanted to be an offender profiler and then realized you don't get jobs like that in the UK. So that just went down the pan. But I changed my pathway from criminology to a psychology, so it was criminology and psychology. But I didn't have the Bachelor of Science accreditation, so I had to do a master's conversion.
right.
Um, so I went down the route which has become a bit more accessible and popular now, I think, where you can do like it part-time or full-time for 12 months.
Mm,
And that allowed me to then apply for the doctorate in clinical psychology.
mhm,
Amongst that, I did a hell of a lot of different voluntary different work experiences, including like NHS befriending, like childline, phone counsellor, volunteering on
mhm,
um, youth panels for probation for I think people under the age of 18 who'd had a first time offence. So like a variety of different experiences to really get um I guess that kind of backing and real life experience of supporting people, who are really struggling or who have had um a lot of really difficult traumatic things happen to them. Um and that was my journey really. And then luckily for me, I'm like a dog with a bone. Um I managed to get onto training, and I got onto training within 2 years of my master's, I think. So I've had everyone has a very different journey. And I think the thing is, when people think about going on to their doctorate in clinical psychology, it can feel like there's a lot of pressure to get on really quickly, or, to have things done in a certain order. But I definitely think there's some real value in taking time out to have some life experience. We all have, commitments in terms of, financial commitments, and ideally it's good to get that financial security first. But in
yeah.
hindsight, I do wonder how my journey would have been, potentially just have been different, I guess, through coming back later in life and having some life experience that I didn't have before I got onto the course. And we definitely had a slightly varied age range, I think, in terms of my cohort. But I'm also hearing really positive news about the investment in the doctorate clinical psychology, and that they've almost doubled, if not tripled, some of the places,
Really?
which is
Yeah.
great news for people that are looking to apply.
Yeah. I mean, what an important message as well, though, to just recognize that if you do apply, it is quite competitive. It's a course that people really, really want to be doing. And if you do apply and you don't get on that year, just to recognize that it's not a wasted year. It's another year where you can gain further experience and explore your skills, increase your level of confidence, and engage with life before starting a doctorate, which I'm sure is really challenging. So I
And
think,
there's
and
the
what, go for it.
Sorry, Daniel. I was just going to mention, going back to the clinical associate psychologist thing, compared to when I was going through the application process, it does feel like there's a lot more avenues now, where people can go into a therapy focused kind of role. Um, Whereas, a number of years ago, it was mainly to be a psychologist is one of the main and only ways you were going to be able to be a therapist, and work in the NHS. And there's so many more opportunities now, which is also
Yeah,
really positive.
yeah, I agree. I agree. And with that kind of increase in terms of the number of different options to get into those therapy facing roles, you've if you want to go for the doctorate, go for it. But you've also got other avenues that you could travel. If that doesn't come about for you. So there's plenty of opportunity for progression above and beyond kind of those starter sort of practitioner roles, or even the clinical associate practitioner roles. Yeah, amazing. Clinical associate psychologist, sorry.
It's a mouthful, isn't it?
Isn't it? Yeah. We tend to just refer to them as CAPs, I think, within the
Yeah.
practice education team. It's easier. Amazing. And another sort of thought, I suppose, in thinking about the therapeutic skills, I'm wondering if you have a sort of favorite therapeutic skill or technique that you find yourself gravitating towards often. Could be in use with clients, or it might be in terms of sort of your own self-care or in supervision. Is there anything that springs to mind?
Oh, you've given me all sorts of inspiration there. It's like, where do I start? And
Yeah.
instead of waffling, I'm going to take a moment to pause and think about like what's my go-to. So I find myself more and more asking myself and others, and whether it's kind of I'm in the therapy room with someone and I'm a therapist, or I'm in supervision, and I'm thinking about something that's bothering me, or just in my personal life. My go-to question for myself and others is, what am I feeling in my body?
Mm, mm,
Um, my next question might be, where do I feel that in my body? And I guess where am I going with this? That curiosity of what's going on inside, if it feels okay for us, can be a really helpful place to start in thinking about what's going on for me, or other people, and what do they need. Um, in terms of something that really helps, in terms of, I think your question was, is it if you're feeling like stressed or
Yeah, so if you wanted, yeah, to look at a way of sort of bolstering your own sense of resiliency or engaging in some form of self-care, is there
yeah.
something that you might gravitate towards?
So going back, thank you for the reminder. So going back to my question about kind of what am I feeling in my body? Often when we ask that question, and particularly if we're working people who come into our services, they're feeling a lot of sensations that are really uncomfortable and feel horrible in their body. We can flip that. And I also use this personally with thinking about areas of my body that might feel good. That can feel
Mm,
quite abstract. So what we might do is start with a memory or a
mm,
time that has felt good for someone or myself, bring that to mind, then notice how that makes us feel. I
mm,
would then guide myself or ask that person that I was working with what they feel in their body and encourage them to connect with that. Might put a hand on that place where they're feeling that sensation that feels good. Um, and I think it's a really nice way of, we use the word install a lot, which sounds very clinical. Install that feeling. I guess what does that mean? It's really like savoring it so that your
mm,
body remembers it, and then it potentially feels easier to access at times when we need it.
mm.
That makes sense. I'm naturally putting my hand here, um, which is interesting, isn't it? We do a lot of this stuff semi or unconsciously, and I think at times where I feel like I need to feel soothed or grounded, I'm having a moment that resonates with me and I'm just kind of savoring it a bit, I will tend to put my hand here, and
Mm,
it looks different for all of us, I guess.
absolutely. Yeah. I mean, I love that. What wonderful advice for, people who are in training or people that are newly qualified to learn or to develop a skill in terms of tuning in with what's going on for you as a whole person in that moment. And that, I suppose, paves the way for showing up authentically and having kind of honest conversations with people about where you're at. I can remember being in supervision and perhaps having to mention that I had a particularly strong and unpleasant feeling towards a patient in the room, and actually having somebody holding space for me to be able to tune into that and work through it was so beneficial for the therapeutic alliance, but also for my own sense of well-being as a practitioner as well. So it's
Yeah.
really lovely to hear you talk about that being one of your go-to skills, and it sounds like it shows up in all of the different, all the different hats that you're wearing, all the different situations you find yourself in. It's one of the things that carries you through. Great to
It
hear.
it's interesting, isn't it? I think I've learnt so much. uh, partly like motivated and driven through my own curiosity, and some amazing experienced colleagues that I have the privilege to work with. In Devon Partnership Trust, there are a number of people who are doing some brilliant embodied work that I've learned so much from. Karen Dudley, who's a dance psychotherapist.
Wow. Yeah.
I don't know if you've heard of her, but she's absolutely brilliant. And I remember one of my initial conversations with her, along with some other people that I've worked with, has been amazing for in terms of inspiring me to dig a bit more and build my own relationship with my body, which has then helped me to feel more confident clinically to support other people and invite other people to do the same in
Yeah.
supporting their own mental well-being. And going back to what you were saying about kind of supervision and the work that we do, the whole reason we're trying to champion, aren't we, like trauma-informed practices. We as staff need to feel held and contained and supported to be able to co-regulate with other people. It's one of going back to the challenges that we talked about towards the beginning, is it's increasingly getting more and more difficult to feel regulated for staff at work with the increasing pressure and lack of stability.
Yeah.
In services, isn't it? That's a real thing, and I think it's something we need to kind of remember and validate, because it's really tricky. It's a tricky time, and so this body work and the real interest in it, that's kind of happening at the moment on social media and things like that is great, because it's really, I believe in it. I love it, obviously, and I think it's really helpful.
Amazing. It's so insightful. As I mentioned, just really, I think, helpful for people when they're starting out their career in whether they're nursing or whether they're psychological professionals or any of the other allied healthcare professionals, just to hold that awareness of, where you're at in that moment and to try and connect with it. It's just so important, I think, in the current climate, especially. You've covered a lot of hints and tips, really, for people who might be listening. But I suppose thinking about learners who might be starting placement in a community mental health team or are particularly interested in sort of exploring clinical psychology or any of the other psychological roles or the CAP role, do you have any advice or tips for anybody in that situation?
People that are looking to move into like a CAP role or on the decline to go for the
Yeah.
decline.
Yeah, or to come and work within a community mental health team in a psychological role. Yeah, so what you said.
I feel, yeah, it's interesting, isn't it? You could come at that question from so many different angles, and I don't know if that's just my philosophical brain or ADHD brain going in all sorts of directions. But I'm thinking about my kind of instant gut reaction was that I feel like I'd really like to support people to think about is what are your personal values and how could that match up with the work that you choose? In terms of, because there are many different directions, aren't there, in terms of how you could work psychologically, but this is such a nerdy psychological way of answering the question, but I genuinely mean it. I'm not trying to say this to be clever, or I think if we can be in line with our values in work, we get so much more job satisfaction and reward. We can come into the work in a more regulated place and genuinely enjoy it more. I feel like my answer, if you'd have asked me that question a few years ago, would have been potentially quite different and more focused on right, what's the right kind of experience to go into those roles? And yes, that's an important and necessary part of what people want to know, don't they, to get onto the declin or a CAP role. And that is important. But what's also important is thinking about job satisfaction in the long term and like purpose and fulfillment. I think that's just as important, isn't it? In terms of kind of the supporting the service we provide to the people that we work with, but also for ourselves. And personally, it's not something that I necessarily thought about when I was going into my career. I think it's really easy for lots of us, particularly when there's lots of pressure and competitiveness and difficulty in getting onto training courses. We can get really caught up in thinking about what does that person want to hear from me? Like, how do I tick these boxes? And that, that like I say, is a really important part. But thinking about it's like a two-way process, isn't it? Thinking about what you really value, what you're going to get out of that role is just as important as what I'm trying to say, I think.
Absolutely. It really resonates. So, as part of the receptorship program, I'm just about to start actually delivering the wellbeing and resiliency workshop that we do with our newly qualified staff, and um, that really focuses in. There's a huge section that looks at kind of values and passions and how we connect with our values and the impact that that can have in terms of our own sense of well-being, and the recognition that we spend a lot of time at work, don't we? So we need that to drive us forward and fulfill us in some way in order to have that balance in life. It's important.
Mm,
But it's also
yeah.
really interesting to hear about how your perspective has changed, in the 10 years that you've been doing the role post qualifying.
Yeah, I mean, I'm not. I feel like this is important to say actually. So my declin. I think when you work in a psychological way with people, you don't necessarily have to have personal therapy, and the supervision that you can have can feel like therapy in a way in terms of how vulnerable or safe to feel vulnerable you're able to
Mm,
be in terms of using
mm,
it for your personal reflection on yourself and how and what you bring to work and your relationship with the people that you work with in therapy. But my declin, the reason I'm bringing this up is my declin didn't advocate for that. And there were
okay.
plenty of really good things about my course, but one of the things that I'd say wasn't really promoted was around self-exploration and therapy. And I know he isn't training as like psychotherapist and other training courses, but potentially that's advocated a lot more, and there's a lot more open
Mm,
conversation about how that can be really helpful.
mm,
Um, and going back to I think what you were saying about kind of well-being and kind of supporting yourself at work and enjoying what you do. um I think it's a really important part. My personal belief is I think that being a psychologist or psychological professional, anyone can benefit, really, psychological or not, actually, working
mm,
in a mental health team can benefit from exploring what you're bringing into your relationships, whether that's in supervision or within your own personal therapy, and can really enhance that. And I think that has kind of really helped me to go thinking in terms of my schema therapy work and what I do with people, or internal family systems, which is quite a similar model but different language.
mm,
That's become very popular at the moment.
mm,
Um, I guess what I'm trying to say is in personal therapy or supervision, what I've personally found very helpful is understanding our different parts, and
mm.
parts that can come out, in relationship with others, in therapy, and thinking about how that dance between our parts and other people's parts, um, is all really important and a big part of the work, I think.
Yeah, absolutely. I mean, what a wonderful kind of last message to send to the listeners, which would have been my next question, but you've jumped in and answered it already, George. Thank you. And I suppose as we wrap up today's episode, George, I just really want to express gratitude to you for joining us and providing us with such insightful perspectives on clinical psychology and some of the thoughts around schema therapy, as well as thinking about some of those challenges that are faced within the mental health field, but in the broader NHS as well. As we speak today. It's been really inspiring to hear about your journey and the meaningful work that you and your team are engaging with within North Devon, and the different hats that you wear and how you kind of make sure that you're upholding all of your values within each one of those roles. Um, and I suppose just as a final message to our listeners, I do hope that you found this conversation to be enlightening, and hopefully empowering as well to pursue your own path within this field. If you are interested in engaging in our podcast or have any ideas around future episodes, give us an email. You can just drop it into the Practice Education inbox, and we'd really love to hear from you. But thanks so much for listening, and keep practicing and keep making progress.